Welcome to channel. In our last video we have discussed about coronavirus disease 2019 COVID-19 causes. In this video we will continue with coronavirus disease 2019 COVID-19 prevention against coronavirus disease 2019 COVID-19. Strategies for preventing transmission of the disease include maintaining overall good personal hygiene, washing hands, avoiding touching the eyes, nose, or mouth with unwashed hands, and coughing or sneezing into a tissue and putting the tissue directly into a waste container. Those who may already have the infection have been advised to wear a surgical mask in public. Physical distancing measures are also recommended to prevent transmission. Many governments have restricted or advised against all non-essential travel to and from countries and areas affected by the outbreak. However, the virus has reached the stage of community spread in large parts of the world. This means that the virus is spreading within communities, and some community members don't know where or how they were infected. Healthcare providers taking care of someone who may be infected are recommended to use standard precautions, contact precautions, and eye protection. Contact tracing is an important method for health authorities to determine the source of an infection and to prevent further transmission. Misconceptions are circulating about how to prevent infection. For example, rinsing the nose and gargling with mouthwash are not effective. As of the 29th of March 2020, there is no COVID-19 vaccine, though many organizations are working to develop one. Hand washing. Hand washing is recommended to prevent the spread of the disease. The CDC recommends that people wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when hands are visibly dirty, before eating, and after blowing one's nose, coughing, or sneezing. The CDC further recommended using an alcohol-based hand sanitizer with at least 60% alcohol by volume when soap and water are not readily available. The WHO advises people to avoid touching the eyes, nose, or mouth with unwashed hands. Respiratory hygiene. Health organizations recommended that people cover their mouth and nose with a bent elbow or a tissue when coughing or sneezing, and disposing of any tissue immediately. Surgical masks are recommended for those who may be infected, as wearing a mask can limit the volume and travel distance of expiratory droplets dispersed when talking, sneezing, and coughing. The WHO has issued instructions on when and how to use masks. According to Stephen Griffin, a virologist at the University of Leeds, wearing a mask can reduce the propensity for people to touch their faces, which is a major source of infection without proper hand hygiene. Masks have also been recommended for use by those taking care of someone who may have the disease. The WHO has recommended the wearing of masks by healthy people only if they are at high risk, such as those who are caring for a person with COVID-19, although they also acknowledge that wearing masks may help people avoid touching their face. China has specifically recommended the use of disposable medical masks by healthy members of the public. Hong Kong recommends wearing a surgical mask when taking public transport or staying in crowded places. 357. Thailand's health officials are encouraging people to make face masks at home out of cloth and wash them daily. 358. The Czech Republic banned going out in public without wearing a mask or covering one's nose and mouth. 359. Face masks have also been widely used in Taiwan, Japan, South Korea, Malaysia, Singapore. Social distancing. Social distancing, also known as physical distancing, includes infection control actions intended to slow the spread of disease by minimizing close contact between individuals. Methods include quarantines, travel restrictions, and the closing of schools, workplaces, stadiums, theaters, or shopping centers. Individuals may apply social distancing methods by staying at home, limiting travel, avoiding crowded areas, using no-contact greetings, and physically distancing themselves from others. Many governments are now mandating or recommending social distancing in regions affected by the outbreak. The maximum gathering size recommended by government bodies and health organizations was swiftly reduced from 250 people, if there was no known COVID-19 spread in a region, to 50 people, and later to 10 people. On the 22nd of March 2020, Germany, older adults and those with underlying medical conditions such as diabetes, heart disease, respiratory disease, hypertension, and compromised immune systems face increased risk of serious illness and complications and have been advised by the CDC to stay home as much as possible in areas of community outbreak. In late March 2020, the WHO and other health bodies began to replace the use of the term social distancing with physical distancing, to clarify that the aim is to reduce physical contact while maintaining social connections, either virtually or at a distance. The use of the term social distancing had led to implications that people should engage in complete social isolation, rather than encouraging them to stay in contact with others through alternative means. In this video we talk about coronavirus disease 2019 COVID-19 precaution, and more. In our next video we talk about self-isolations against coronavirus disease 2019 COVID-19.
Press the bell icon on the YouTube app and never miss